members of staff, including our CFO. Despite significant and growing investment in social services, outcomes for our most vulnerable remain poor. Put simply, people with complex needs are not well served by fragmented and siloed system in which services are divided up between different agencies. Time and again, they slip through the cracks. They need integrated solutions delivered early to prevent a cycle of crisis intervention throughout their lives. The role of the SIA is to identify opportunities to break the cycle, to ensure people with complex needs receive the kind of support they need before the crisis point. To do that, we're using data to see who's at risk of acting early. We're trusting communities and providers to design solutions, and we're giving them the resources and freedom to deliver. We're collecting and monitoring evidence of what's working and what isn't. In our first year, we've focused on establishing the foundations for complex, multifaceted system change, with a particular emphasis on data, evidence, and targeted investment. A core part of this work has been opening up access to data and evidence. We've developed a regional data explorer tool that will enable local providers and commissioners to understand population trends and outcomes in their communities, who needs support, what works, and where the gaps exist. This shifts us towards evidence-informed practice at a local level. Social investment requires clarity about who we're supporting, so we're using data to identify cohorts at greatest risk of poor outcomes. We want to understand not just their immediate needs, but the interconnected challenges they are facing. This approach allows us to target interventions where they'll have the greatest impact and track outcomes over time. As a central agency and a system lead, our role is to lead the implementation of the social investment approach, build the infrastructure and tools required, and demonstrate how aspects of social investment can work in practice. Our engagement with other agencies across the social system is already bearing fruit, and we are beginning to see agencies applying a social investment lens to their commissioning programs. We will continue to work to shift the system, setting standards and using data and evidence so the system invests earlier and more effectively to change lives. Budget 25 allocated $190 million to the Social Investment Fund over 4 years. Ministers subsequently decided priority cohorts, and in August 25, round 1 procurement process was openly advertised. That process and foundations we laid down over the 24-25 financial year are now paying off. Most recently, the Minister for Social Investment announced 7 organisations working with children and families of complex needs that have been selected to receive funding through Pathway 1 new initiatives. Together, they stand to receive $50 million over 4 years, delivering programs supporting 1,600 children and their families per year. Pathway 2 will consolidate contracts across multiple government departments, reducing the sort of fragmentation that sees providers managing dozens of separate funding streams, spending more time writing reports for Wellington and less time delivering vital services. We expect to announce the results of Pathway 2 process early in the new year. Everywhere else, work is well underway, scoping and designing Pathways 3 and 4, which involve local commissioning and co-investment with iwi, philanthropists and community trusts. This year, we are shifting from design to delivery, implementing outcomes-based contracting, open those partnership pathways, working directly with agencies to demonstrate what social investment looks like in practice. It's worth emphasising that while our own efforts amount to only a tiny sum of the overall social services spending, our work is about leading and demonstrating an approach to social spending that comes to redefine the way all social services are designed and delivered. With that in mind, we will continue to bolster our system lead role with guidance and standards to embed social investment principles across the sector. Ultimately, we want to put decisions and the information needed to make them as close as possible to the people they affect, and that will be guiding our process in the year to come. Thank you, Mr. Chair. We welcome the committee's questions.
Thank you very much. First question is from Lawrence.
Thank you, Chair. Thank you for coming and thank you for the work that you do. My first question is just picking up on something you said, where you said Minister decided on priority cohort. How then, because the idea of the agency is a long-term focus and you said outcome focused, what happens then when the Minister changed their mind and then they decide to prioritize something else? How then would you measure the outcome?
Our role is to present the best advice we can to ministers, so they decide the particular cohorts. We implement the decisions that they make, but our advice is very transparent about how we came across those cohorts, how we selected those cohorts, and gave that advice. they are some of the most vulnerable populations in this country, but who are likely to have the most long-term poor outcomes. Is there anything you would like to add to that, Joe?
I think only that the cohorts we're investing, we're entering into 4-year arrangements with those organisations to support those changes. The ambition here is that the fund does grow over time, and that additional investment in further cohorts would be dependent upon additional funding. Ultimately, there is a hard edge to the fund. You're investing in social services, you're looking for the return on those, and continued investment obviously depends upon you having continued confidence in that return.
Just a couple of supplementary questions, and other people may have subs as well. But in terms of the outcomes, I'm looking also at your non-financial performance indicators in the budget. Nothing in that financial indicator talks about outcomes. It talks about advice that you provide to the thing. So, for example, I've seen that, like, for example, on page 19 of your report, you mentioned a lot of initiatives that you have taken, tangible ones. How are you going to measure the outcomes, and what happens when the money that you've allocated for it ran out and you didn't achieve the outcomes you wanted?
Ultimately, you need to use investment logic to test to see if we're delivering the outcomes that we are expecting to see. We have quite a robust process of the outcomes and the interim indicators that we would expect to see if we're making progress. If it's not working, we need to work with those providers to see if there is a better way we can do to deliver those outcomes. We need regular measurement and data to see if we are making the most effective, we're getting the most effective results, recognising that these providers are working with some of the most complex situations in the country. These results won't come out in a linear, progressive way. They need to have the time and the scope to work with those very vulnerable clients and communities. So they've got the ability to do that. But ultimately, we do need to be keeping regular tracking to see if we're making the progress that we would hope to be doing. When we go into a original contract with a provider, we ask them for it to develop a theory of change that allows that provider to demonstrate to us, and we work alongside them, of the expected results that they would expect to see with their particular supports that they can provide. We can then go and measure that to see if that theory of change is actually playing out in reality. That will deliver, over time, indications that we are making success. And if we're not seeing that success, then it's a transparent conversation with that provider about what we can do to change tech if we're not delivering that.
One final supplementary question. If we can just go into one example. On page 19, you mentioned early years support, Autism New Zealand. This is hugely important, I agree. What then would your outcomes be for that? When do you expect to see some form of outcome? And also, more importantly, it talks about the needs of autistic children and children showing signs of autism. The barrier that we have now in terms of autism is diagnosis. Diagnosis is hugely expensive. So is that going to be also a factor that's addressed in here?
I'll ask Joe to address that question. He's been leading this particular bit of work.
Yeah, and it's a great example to walk through. Thank you. That particular initiative is using some very early screening tools and supporting frontline professionals who work with new parents and very young children to identify people with potentially neurodivergent behaviours at an early age. They then wrap some extra support around those parents and give them some effectively some tools and techniques that they might want to consider using that reflect the difference, and also in terms of ECE teachers and other people who are engaged with those children. That theory of change that the organisation has put forward looks at early identification. It looks at families and educators better understanding the needs of autistic children and the strategies they can use to have a positive impact in terms of long-term outcomes, to decrease child expression of distress and to reduce parental stress and increase parental sense of competence and confidence. Ultimately, though, and this is, again, a great example, the actual outcomes that you see from that investment are 4, 5, 6 years hence. You're looking at young children who are in the early stages of school and are more confident and capable and supported in being there than they would have been otherwise if they hadn't had those supports through that early phase. So we're looking, that's also an initiative that is quite different, and it's testing something new. And it's one of the early tests, if you like, of initiatives that might make a wider change to public service and social services across the country in time. If what they're doing works and has a significant impact and we can clearly see the return on that, then that's something that you want to see adopted across the country.
Your question, Jen.
Thank you, and thank you for that. I guess reading the annual report, one thing that I felt was missing, which would be understandable in the first year, is the stakeholder feedback coming through, which I, of course, can't see any of that. But there has been quite a lot of it outside of your annual report, and it's not all been positive. At the AUT's recent social transformation research, there was a very strong panel who were very critical of the Social Investment Agency and your approach to social investment, and particularly around the fact that you talk about being disruptors, and I don't disagree with that, but disruption for them looked like 6-month contracts because people weren't aware of what was going on, and the fact that they couldn't get staff and small NGOs shutting down. What's the price to our country if that happens and we don't have those people there in the interim until this all takes off? And what do you have to say to that?
So some of those smaller providers play a crucial role, but we can only fund what we have been mandated to fund. What we need to do is ensure that in this particular sense, that those providers have access to the most appropriate data that they can see, so they can make changes that they can, where they feel is appropriate, so they really understand the needs of their community with the data that government has. We've developed a regional data explorer tool, which allows those communities to have far greater access to that data. Also, the arrangements that we're putting in place take a longer term look at their contracts, so they've got more robustness. Outside of the Social Investment Agency, I can't particularly comment, unless, Joe, you've got something more to add to that.
I think only to say that the Social Investment Fund is less than 1% government's investment in social services. It wasn't designed to take over or to supplement or in any kind of sequence for funding that was reduced from other organisations as a result of decisions taken by other agencies. So I wasn't quite clear on the question there.
So I think that's a really good point that you're making, and we've had this conversation before when I had my briefing, which was great, thank you for that. But that's not what's coming through from other agencies, and these NGOs are getting 6-month contracts, not able to employ staff because the other agencies are concerned about what's going to happen with procurement because of the Social Investment Agency. They are saying that we're not sure where this is going, and the social investment. So it is a responsibility of yours and the interactions that you have with those agencies. And we are seeing some of those NGOs collapsing. To your point about the data, at that same panel, one of the panelists said, I've spent $30,000 on an impact lab report proving that I am making, or my organisation is making a difference. But I still cannot get the funding long term now because of this disruption that's happened to the sector, and no one's going beyond 6 months.
Again, we can't really speak for other agencies' practices. What we can do is ensure that we're working very closely with those agencies so they understand our practices and what we're up to. The other pathway which this may be leading into is the contract consolidation pathway, which is... That
was my next question, so I'd love to hear more about that. Thank you.
Which is a pathway where NGOs can apply to consolidate multiple government contracts where it feels most appropriate. They're working with a particular cohort from various different funding agencies. They can then apply to us and work with us to see if there's mechanisms where we can simplify their contracting and put it onto an outcomes-based contract, and allow for them to work more closely in their communities with those particular cohorts, despite not having to marry up various priorities from various different agencies. We will do that on those agencies' behalf. But it simplifies their reporting and allows them to have far more flexibility over that contract, so they can respond to the needs as they see it. Again, Joe, is there more you want to add in that particular space? He's leading this bit of work.
I think we can come back to the contract consolidation tool. I just think it's really important to say we've been crystal clear with agencies about our plans for the next year or two and what those investments mean. Ministers have set us very clear priorities and cohorts that we're investing in. We've also spoken to hundreds of staff and leaders from the social sector. across NGOs, and again, been really clear about what we're setting out to do. I think I would acknowledge that for many smaller organisations, they don't see themselves in the social investment fund at the moment in terms of the new investment pathway, but we are seeing some really strong applications coming through contract consolidation. And also in the most recent round of funding, we've seen one collective of smaller organisations that's come through successfully. Yeah, and I think that's really encouraging. Organisations recognising that it's difficult to have the backbone around data and insights that you might need to be in that social investment space. But if you club together and think about it collectively, and we support, then there's opportunities there.
Supplementary, Paul.
Just a sub to that, Alistair, I wanted to ask about how you have found work with other agencies and how that has tied into your work. And is there good cooperation? Is there an understanding of what you're doing? And are they eager? And is there help along the way?
I would say as a general theme that those agencies are very, very supportive and want to lean right into support where they can, where it's appropriate. There's obviously some boundaries that we need to take where agencies have statutory responsibilities to deliver a particular service. Rangatamariki is a classic example, but most of those other ones, we need to be very clear that we're not, that they're able to perform those particular functions. So those contracts may be, depending on the exact situations, more appropriate to sit back with those host agencies. It will depend very much on the circumstances that it is. The other aspect is, say, clinical services. That probably is far more appropriate to sit with the Health New Zealand rather than us. We're still working through a number of these particular issues, and it really does have to be done on a case-by-case basis. But the cooperation from the agencies has been really outstanding.
Mr. Chair, just that. And just to follow up, do you have an alignment of cohorts? Because you've mentioned identifying cohorts where the focus needs to be on. And do you find that the other agencies have an alignment of cohorts with yourselves?
Generally, there is an alignment of cohorts. You've got to remember these agencies, they have vertical accountabilities where they've got to look after a particular system.
Yes.
We are focused more on that horizontal, where we need to look at those cohorts along multiple different ways, looking at their developments over a particular life course or how they react as human beings. So there's just different ways of looking at this particular view. Our cohorts that we've selected have come from various different mechanisms, but generally we have had expertise in the data for many, many years. And what we've identified is some particular cohorts that keep on appearing as more likely to have very, very poor outcomes. There's many different ways you can cut the data and many different ways you can do that. But this is the first attempt to have a go at looking at this cohort-based approach and really taking a different look at it, working closely with the vertical agencies, but taking a more appropriate sense where we can allow those providers to look right across their agencies. If there's anything you want to mention in the cohort space?
I think that's right. The cohorts enable us to take a cross-cutting view of a small population and their service interactions and life experiences over time, and then through the fund to identify how to invest earlier to get better outcomes for those cohorts, and then put in place the continuous feedback loops that enable us to see whether we are achieving what we expected to achieve through those investments. With interactions with other agencies, we are able to see in the data whether and how cohorts are already interacting with those services. And the two halves, so the fund and then looking back at agencies, will enable us to say where could agencies also start to improve over time to get the best outcome from the relatively modest investment through the fund.
Thank you.
New question, Maureen.
Thank you. Some of it's actually been covered in some of the presentation already, so thank you very much for that. I note that with the 3 demonstration initiatives already underway, that it's been the opportunity now to bring together some of these programs that would otherwise not have had the funding allocated. And it was common feedback from NGOs that the siloed-based contracting, which had clear KPIs, were not always appropriate in every community, given what's available. So in terms of us as a committee, reviewing performance of this new way of doing things, given that it's very long term, and we review on an annual basis. At what point are you going to know whether success is in sight or whether it's time to adjust?
Again, it's slightly been different. It will depend slightly on each individual program, but overall, we need to, for starters, I think the Social Investment Fund has been a missing part of the system architecture for a while, which has been able to take a longer term, but also portfolio neutral view, like some of these particular cohorts. So this is so it is, as you say, something new, which we need to start from scratch. We progressively over time need to start reporting on the portfolio of investments that we have. We've got 3 and we've announced another 7 that we're starting to work with. As that gets bigger, this committee will have a strong interest in the overall performance of the fund. There'll be some particular investments that are higher risk and may or may not pay off. There'll be some that are more conservative, and we've got far more likely to do that. We'll need to work out our reporting mechanisms to provide a lot of transparency to the committee to show exactly how that's going to work. Because I completely agree, there needs to be a depth of understanding from this committee so you can understand exactly what our progress is, while also recognising that earlier statement that I said that some of these things won't take necessarily a linear approach to see how the progress is when you're working at that very vulnerable end of that community. We may know success in different ways depending on the individual or the whānau in concern. For example, we can't predict in 3 or 4 years' time how strong engagement with the NGO will come out necessarily. We'll have a good idea based on our theory of change, but it may appear in more regular school attendance. It may appear in enrolment with the GP. We're not quite sure. Again, those are going to be individual circumstances, which we need to work out. We are working out a way to report this transparently. So there's allow people like yourselves to take good scrutiny of the work we're doing. And also allow us to, for our own internal measurement, to see if what we're doing is working, and if not, adjust it. Because fundamentally, these communities need the support that we are providing, and they need us to get it right.
Can I supplement that, Chair, if you don't mind, just because it comes back to a question that I'm not sure we quite responded to earlier. We're currently reviewing, we've got an outcomes framework for the investments, so we're investing against those outcomes framework, and the measures we're using for that will, through our strategy, be part of our annual measures next year, and they're in development, which is a question earlier. Just in terms of the early signs of success, I think you can think of that in 4 stages. The first is actually making an astute investment in the first place. So is there a clear theory of change? Is it credible? Is there evidence behind it? Do the community support that organisation? Does that organisation have the relationships and connections to the public and other social services locally that it's going to need to be successful? So that initial assessment, and based on the cohort and the potential changes that cohort could achieve with the right supports, all of those things come together to make a decision. And ultimately, what I'll be held to account for as running the fund is that fund is generating a return that we can clearly see and evidence. As we enter the middle stages of that investment, some of those early and intermediate outcomes start to come through, and that starts to give us confidence as to whether that theory is turning out in practice. And again, that enables us to report quarterly to our Social Investment Fund Ministers Group, and obviously that will enable us to provide richer material to this committee on an annual basis. Ultimately, the evaluation plan matures on that investment, and we get a robust look back at the activities, what's contributed most to the outcomes that we've seen, what can we learn from that evaluation, and how do we play that learning back into our new investments rolling forward. So we're trying to get that fund cycle running and based on evidence and learning so that we can make smarter and smarter investments over time and help the social sector be as successful as it can be.
Yeah, and it's great to have that on record too, for the committee in the future, so that we're all aware of the challenges and opportunities. One of the things that you're obviously basing the measurement on is data. And we've had a presentation about the IDI, but one of the gaps they referred to was around health and mentioned being enrolled in a GP or whatever. But at the same time, if all of those systems don't talk to each other, then it's difficult to accumulate that data. Is there anything that you've done to maybe help initiate some change in that?
I'll let Afra get into this in a second, but basically there's two aspects to that. The IDI and the more data getting into the IDI is incredibly important, and part of our role as a central agency is start to put pressure on the system for that to happen. The second part is data by itself needs to be interpreted and put into context sometimes with that community understanding of what's going on in that particular region and those particular bits. Data can be misconstrued if not used thoughtfully, and we need to be very careful that that's done properly. However, the IDI is an incredible asset to New Zealand, and we can do incredible amounts with that. It's very important. If I can probably give you a quick update of the progress that's been made, because considerable amounts of progress have been made over the last year, and there's a lot of momentum happening in this space.
Yeah. We've worked very closely with Stats New Zealand over the past year and actually building on our long-standing relationship with Stats. I understand the last data load for the IDI was the biggest ever, and that's probably largely due to a lot of the work that we've done across agencies and to identify missing data sets that would be helpful for us and for providers in understanding their impact. So there are 13 new data sets that have gone into the IDI and 18 have been updated, and the frequency of updates will be improved as well, so that it's, as Alistair said, it's not just getting data into the IDI, but it's also giving that data back. The second part of what we have done over the last year is to work with providers and with Stats to streamline the process for providers themselves to get their data into the IDI. We created, a standardised manual for that and made it easy, and we have a standard operating practice now with Stats as well. And we're now being able to give back that data to providers and to communities in a way, as Alistair said, that's really understandable and which verified some of their instincts about what they already knew with their services. And we're able to provide that back to them and say, here's who you're reaching, here's the impact you're having, here's the other services that the people that you're reaching are interacting with. And that will enable them to improve the quality of their services.
Thank you.
I have a question too, which I might bring in here as a supplementary. So in the last couple of years, as sort of chairing this committee, I've been really interested in hearing all these agencies and entities that work in the social sphere. And a lot of talk about we need to focus on outcomes versus outputs. I think there's a general agreement that that's what needs to happen. What's really difficult and what I haven't yet heard a clear articulation of is how to actually identify what outcomes are with the complexity of the environments and people and personalities that agencies are dealing with, and how to then format what an outcome is, and over a sort of a particular period of time as well. So I'm interested in what you're doing. If you sort of articulate a bit, Joe, there's a bit of the framework, there's theory of change and how you're going to map against that over time. I'm sort of, how are you going to look at this differently, and how are you going to use data, and how are you going to encourage other entities to collate data to then dashboard for decision makers, go, okay, we are actually achieving outcomes.
It's a couple of things, but I'll allow Afra to speak to this because we've done a lot of work in this space. And I think we also need to remember that perfect is the enemy of good in this particular place, because we're working our way through this. We need to do this progressively, and we'll learn as we go ahead. But we have we've developed a methodology which has allowed us to steer some of where we put a figure on some of our investments of what we'd expect to achieve. And this allows us basically it's a cost benefit analysis, but we do that prior to the effect, and we do this into the IDI using two different cohorts of two population cohorts in the IDI. One is the one that we expect to see, and one is a very like for like. The IDI, this is one of the beauties of the IDI. It's such a large database. We can find a relatively similar population in that database. It doesn't have to be absolutely perfect, but it allows us to measure what the results that we're getting, and if we're starting to achieve some of those outcomes that we talked about. The outcomes vary, as you say, whānau to whānau, family to family, in particular places, but fundamentally we're looking for those whānau to have greater agency over their own decision making. And we also see a lot of the government targets and things like that measured in outcomes. So we will see greater, more children turning up to school through these initiatives. We'll see greater GP enrolment, which will lead to reductions in emergency department appearances, those sorts of things. But Afra, do you want to go into more depth about it?
Yeah, I think the point Alistair made about perfection not being the enemy of the good is useful here. What we're trying is to simplify the measurement of social services, and we've started by setting out, and Social Investment Fund ministers have agreed the high-level outcome areas for the fund. Those are, for example, improved health, greater safety, ensuring stable and secure housing, and improving knowledge and skills, growing income and wealth, and supporting people into work. Those are our high-level outcome statements for the fund that shouldn't change very rapidly or very frequently. And then we would propose to measure those through a very small number of indicators that tell us something about progress. So for reduced serious health events, you would look at acute hospitalisations in the last 12 months. Say for safety, you'd want to know about count of violent offences and police proceedings. Those tell us about the trajectories of the cohorts. But most importantly, what providers and families themselves count as progress will be able to be connected in the IDI with these measures, and over time we will understand the connection between those qualitative measurements through to those big outcome statements. So we've got a long-term investment portfolio, and we can start to connect the data, say what is it that we're wanting to achieve, what is it that providers are seeing in their own data, and then how does that link towards those slightly bigger population measures of success.
That's such a big challenge, isn't it? So it's actually identifying what a measure of success looks in terms of an outcome. I was thinking, here I'm saying in terms of what whānau sees as success as well. That's important as well, but it's also identifying what that is and how to measure against that could be a bit of a challenge as well.
This will always be an iterative process as we get more data into the IDI, but also as we learn more about what these successes look like. We want to, a large part of social investment is taking learning loops, so working with those providers who are working with those whānau to understand what actually really worked on the ground. We can have all the theory we like in Wellington, but if it doesn't work on the ground with those providers, and if it's not measurable, we need to be able to change tech and have confidence if we need to be able to provide confidence to ministers that we are delivering what we expect to do. And if not, we need to be able to flag that with ministers early enough that there's a chance to change tech. That needs to be robust and transparent.
Just in terms of the data collection, to sort of incorporate in part of my long question, but what work will you be doing with, say, whānau, with agencies, with entities that you're working with to collect that data that's actually going to help inform, progress or otherwise?
Yeah, sure. Okay, so at the beginning of an investment, we agree an evaluation plan, we agree a set of outcomes, and obviously we sign off on a theory of change that's credible. The organisation involved will collect some information themselves, as you fully expect them to, as learning organisations with a focus on achieving change in communities. The only thing that they share into the IDI when they work with us on new investments is a start date, an end date, and an identifier for the individual. There's nothing else there. What that allows us to do is play who that cohort is and what we know about that cohort back to that organisation. Not in a disclosive way, but basically, here's the 1,000 people that you supporting last year, or here's the 500 people that you're supporting now. Here's what we know about that cohort. Over time, the IDI collects events. They're quite deficit-focused events. They are hospital admissions, they are benefit amounts and claims and so on, in quite a lot of detail. What that means for us is that over time, we can see how that cohort interacts with public services, and we can see the direct and some of the estimated fiscal costs of those engagements. Now, obviously, the organisation on the ground is focused on helping people and families achieve their goals. But the hypothesis here, which we share with those organisations, that if they achieve those goals and they achieve those outcomes, that does mean more people in work. It does mean safer households. It does mean less hospital admissions. It does mean less negative outcomes. And effectively, that's what we're tracking together. In my view, the challenge is not actually measuring the outcomes as defined in the Our Outcomes framework. It's the attribution. It's understanding whether those outcomes have changed or are shifting as a result of that services intervention. And that's where the method gets tricky. You sometimes you can see it very, very clearly. Sometimes there's a bit more of a nuance to that. And ultimately, as we get into years 3 and 4, our practice needs to be mature enough to understand that and to be really confident about attribution and to make sure that the methodologies we're using reflect that, and we can continue to make smarter investments.
Thank you. Supplementary, Laura.
Thanks, Mr. Chair, and apologies, my voice is a bit off this morning. My question's kind of following on from Joseph, if I can get it out. Do you think then the data, the IDI data is correct, or do you think we need to have some other measures in there in order to be able to, like, is the data we're collecting enough? Is it the right data for starters? And if I look at like previous contracts where they are very output based, I mean, some of this data is output at the IDI, which is fine. But I think as a starting point, like, is the information we're collecting actually the right information? Do we need to add some things to that? And secondly, I know that organisations in the past, like when they've been collecting their output data, they're always concerned at the time it takes, the amount of staff and resourcing that it takes. So I'm really keen and interested to know what in these new contracts, you're saying that they are moving towards, yes, there'll be some requirements to report more on the outcomes, but there won't be the outputs. Have you done a bit of discussion or research around like how much effort that is taking from some of these organisations and whether it's valuable, I guess?
Yeah, I'll let Joe speak, but we've done a lot of thought into this space. It's basically is an opening statement. We could always have more data. A lot of it is how it's interpreted and how it is analysed. So you can make, and you're very transparent about the assumptions that you're making when you're doing that. And then also being quite collaborative with those providers to understand the interpretation of it. But Joe, you've got a lot of thinking on this.
Yeah, I mean, firstly, this is a great opportunity to make a really important point, is we've turned that model on its head. So we're not sat in Wellington rooms on whiteboards designing service specifications and contracts. We're asking organisations to tell us how they would deliver change in their communities and the outcomes that are of interest to them and us. What that means is they design the service, they identify the measures that they want to use to measure progress, and they track that progress in those intermediate measures and share that progress with us so that we can understand how things are moving. So ultimately, it moves the focus onto agreeing upfront on that theory of change and then wrapping an outcome agreement around that theory of change and managing it as an agreement moving forward. So the information that organisations are collecting is the information that they want to collect, they need to collect to understand progress. Now, to answer the first part of the question, again, really important, ultimately, as we do the evaluation, we get to see whether those outcomes changing are changing as we expected, given the intermediate outcomes. And maybe we start to see that those intermediate outcomes don't necessarily predict the outcomes as we thought they would. And we might identify some other things that are. And that's where the learning comes in, is saying we're seeing these things move, but maybe we're not seeing the changes in 2 or 3 years' time. Why not? What can we learn from that? And how do we do a little bit of redesign with you and to make sure that practice is sound and the measures are sound? So I think that kind of that old contracting for outputs model where you specify a document and hand it over and says, deliver this, go around see someone twice every week and 3 times on a Thursday, is flipped on its head to saying, what do you need to do to achieve outcomes? And how can we use government data to help you learn from and push forward on that and be successful ultimately?
Any question, Jamie?
If I go onto the street today and talk to some constituents and say social investment agencies come in, you've given a lot of terminology and I'm just trying to get to the basics of it. Who are the vulnerable people and who are the vulnerable communities? And from, obviously there's some obvious ones, but from what you've done so far, who are some of the ones that aren't as obvious when you actually go through your data?
When you go through the data, again, both these guys have probably got a point of view to add into this. I would say there's certain communities that are struggling, and we know that, as you just alluded to. There are a number of populations that are potentially a bit more hidden from that. They will not appear so overtly on the street and things like that, but they most likely to have some mental health or neurodiversity issues that can be really worked with, especially up front before they manifest themselves into a crisis. Again, this is the whole part of it. There's also some communities that just taken it in when they're interacted with in a more compassionate way, will benefit from just being treated with some sort of respect and doing that. The population that we really need to think hard about, where the science will lead you to, is in that first 2,000 days. Those populations, younger kids who may have everything stacked against them from when they're born, but at the moment, the system will try and deal with that as well as it can through the universal services, but it'll only reach the threshold for greater support when something really flares up in their particular situation. That may be, and that's one of the reasons why our cohorts are of particular interest. Kids have been stood down before the age of 12. There's a big sign of poor outcomes. Children of people who have parents who are incarcerated or recently incarcerated. Again, these are the populations that may not appear every day around the place that are going to they're not necessarily on the street making overt cries for help in a way, but they are populations that we know with all the data that are likely to have much poorer outcomes. There will be differences, again, how these things manifest themselves, but they all end up being poor outcomes. Sometimes males may act out more aggressively, females may tend to get other poor outcomes like earlier pregnancies or things like that, which may not come across as obviously through 111 calls and things like that.
Can I just quick supplementary? Do people actually know they're a vulnerable person or they're in a vulnerable community, or is it actually the data that tells you that, or is it that obvious that most people would realise?
I think we need to be very careful in this space because there's some people that they may have everything set, but they're so incredibly resilient that they will that we shouldn't be putting a label on people just because they come up within a particular number. A lot of social investment is ensuring that the resources are put in the most appropriate places, so then those people on the ground can make those judgments. Other people who face to face, I shouldn't be making any of those decisions about who's vulnerable, who's not. I can steer the data to allow those providers to make those decisions on that part. There's some incredible stories of resilience despite all the circumstances. So we need to be very, very careful about putting labels on particular people. However, we do know through many, many years of data that there are populations that are higher risk than others, and that's how we should allocate resources. Anything you do?
It was very carefully articulated.
It was indeed. And new question.
It's not actually, it sort of turns into a start from here. I've changed questions several times. It's really interesting what you're saying. And I appreciate that people are trying to do incredibly good work. And I have looked at those issues with the young women who have got parents who have been imprisoned and how important the work is in that area. But I also have the family and sexual violence portfolio. And I've become increasingly aware that there are older women who are becoming homeless and they aren't as popular a cause. They're not as cute. They haven't got as long a life into the community. What happens to people like that where they're a small cohort, but they're absolutely, I'm worried they're going to get overlooked. When we choose these priorities, and often we put it down to mental health. We put it, actually it's about affordability of housing and vulnerability. So what happens with those groups in your systems where they're just not as appealing a group?
I think there's a couple of roles for the agency in this particular sense. The Social Investment Fund is governed by a group of ministers and they have their cohorts quite clearly defined. And that's based on our advice. The other part to Social Investment Agency is the central agency role, where we have a role to start to shine a light on areas of either greater need, cohorts of concern, those sorts of aspects. So ministers have the full advice able to them. This will be a progressive thing as we build up our resources over time.
Yeah.
It will depend slightly on where our data does take us. We need to be quite careful as we go through this that we're not reacting to the issues of the day, but looking at where the data will start to show and point those things out. But progressively, that's one of the rationales for the central agency function, that we have the ability to look right across the system and start to see where greater either need is or where greater opportunities are for better support to allow for that.
But can I just drill down on that one? Let's just look at that example.
Yep.
Those women don't go into our refuges because women with children get priority. They are a small cohort. They are not politically appealing in the same way. What do you do as an agency and how do you set up in your first year? And I appreciate it's overwhelming to make sure that you are leading in the space of otherwise forgotten cohorts.
I think we need to be very thoughtful that we're following data and where the science will also point to you with these things. Again, these are very tricky. There's going to be numerous examples.
It's really hard. I'm sorry.
And it will be a progressive thing over time, where we need to, again, we just need to look into the IDI and identify those particular populations, looking at the outcomes over time. How we measure them also matters, what data goes into it. All these things all add up cumulatively to greater advice. So the decision makers have all the advice put in front of them. This is not a quick thing that will happen overnight, but progressively, that's part of our role. We need to be doing that.
You need to lead in that space.
We've got a role to start to lead the social investment system. That sometimes will mean shining a light. That will sometimes mean doing some of the stuff through the Social Investment Fund. It will also mean building the tools and architecture so other agencies can do it. Again, on the particular population, that particular example you said may be better housed, responded to by a different government agency. But if we are working with them and understanding, looking at a population lens rather than the vertical lens, we can start to put pressure on the system and give more evidence-based advice so people can make those decisions.
Thank
Supplementary, Madam Minnow.
Thank you, Mr. Chair. Apologies for lateness. Just to the IDI, if I can just swing to that a little bit. And so generally Māori communities have a reasonable mistrust, I guess, in this space and data and the sovereignty of data. And so my first question is around the IDI modelling and the bias that is bound to exist. How do you look after that so that Māori data is understood carefully enough to get a good model that satisfies the groups or the space that you're dealing with. And I appreciate, it's good to, and I think it might even come back to Maureen's question about the whole integrated contracts back in the day, siloed stuff, because I was obviously, and I remember you, of course, in the children's team times, and sitting and having our little sticky notes and thinking, what makes an outcome? And some funny person said, I think it's when you add all the outcomes, all the outputs together, they call outcome boss. Whether that was me, by the way. But we were trying to be like, how do you do this? And here we are again in 2025 trying to figure that out. And when we talk about this as a progressive thing and it's an iterative, and all the time, children remain vulnerable and become more so, and their families remain vulnerable and become more so.
Mhm.
So, yeah, sorry, that's quite.
It's one of those, it's a dilemma.
Yes.
How fast
Yes.
do you go? There's plenty of things to work with. I think on the data sense, and especially in the Māori data space, if we can go into this more in a sec, we need to be really cognizant and respectful about the use of the data. We need to, as an agency, we need to be very transparent about how we're doing things so people have a chance to really understand this. We need to remember that this is not my data. It's not it's individuals' data, it's people's data, it's about them. We need to be very thoughtful about how we go about using that. As from the social investment perspective, we need to ensure that we maintain the social license to use people's data. A lot of that means giving that data back and extracting it. The IDI, for all its benefits, we've employed a team of people with PhDs in statistics. It's hard to access and hard to interpret. So we've got part of our role is to extract that data, put it into a format that can be understood transparently, and give that back to various communities, however they describe themselves. We've been working closely with some iwi in this particular space, and therefore you may want to jump into this.
Yeah. I think the key for us in using the IDI is that transparency, but also in the interpretation of the data. It's not our interpretation, and when we work with our iwi partners, we're often working quite hard to really understand what questions they're seeking to answer, and then testing constantly, is this what you're interested in? Is this how you think about it? Well, we could do this in a different way to show you what's available. So it's a real iterative process when working with our iwi partners.
Thank you. Just so, did you just say before, the need to, and I agree, I think it's good, does need to equal actually will? When your response, we need to respect and we need to do those things. Will that actualize and be, yes, we do have that capacity, even in the PhDs? Do you have that capability to the PhD level in both these sort of world views? I'd be interested.
One of our core values as an agency has been transparent by nature. I'm very cognizant of the learnings that happened back in about 2016 when data was, one government agency insisted on data coming into them. And there was quite rightly some resistance to that. There's also been a strong view in the Māori data sovereignty space. This is a complex, complicated world where we need to have respectful conversations. So yes, we cannot do our job using this data and giving the best advice to ministers without the confidence of the wider community that we're doing that in a particular way. So it's a core part of our business, fundamentally, what you're asking. We will stumble into some mistakes, but we will apologise for that and we'll put our hand up when we do that incorrectly. And people will always have their own interpretations depending on their particular context. So we need to be incredibly thoughtful and recognising that this data it's about people. I think it needs to be very clear that no one in this agency sees the name of any particular person for a start. We only see it at an aggregated level. this is not about sharing little Jimmy's story and things like that. That is for the people on the ground, the frontline people who need to know that information. It's also a need to know part of this. How we interpret that and give that back is very, very important, and we will continue to work with those communities as transparently as we can.
New question, Lawrence.
Thank you. I just have two related questions. The first one, so you mentioned before in terms of consolidation, and this is something that the Honourable Gentinetti has sort of mentioned as a potential concern as well in terms of that smaller NGOs. The kind of data that now they have to collect is hugely expensive. So naturally, they price themselves out for a lot of these sort of things. How long do you prevent consolidation and ensure it doesn't equal then to monopolization? And then a one-size-fits-all model where smaller NGOs simply do not have the ability to actually do the work or get funded.
Joe's done a lot of thinking in this particular space, and he's got a lot of expertise. I recognise there is some high overhead. Our methodology, we actually ask for less data than is currently provided, and we will, when those contracts are consolidated, which should be a lower overhead over time. There is opportunities also for NGOs to think about how they can sort of also team up together and work together more at a sort of back office level so they can do that more efficiently. But Joe, you've been doing a lot of thinking in this space.
And firstly, just a point of clarity, the contract consolidation pathway is not constrained by specific cohorts. Any organisation that is meeting the needs of a similar group of people with multiple contracts from government can make an application for consolidation. I just want to make that clear up front. And actually about half of the ones that we're recommending are in the family harm space, because organisations do have quite a lot of funders in that space and they want to tidy up some of that arrangement. In terms of consolidation, I think it's important to turn this on its head. Those organisations that are in communities delivering social services, particularly for families facing multiple challenges, they know that they need the systems and data and infrastructure to be able to track what's going on. They need to log their concerns, they need to see progress, they need to learn from what they do and feed that into their daily practice. Many of those smaller organisations haven't had, frankly, the resources to be able to put some of those systems and infrastructure in place. What we're doing with social investment is setting a bit of a stall out in terms of government and the social sector wanting to be better informed by data, wanting to better learn from that information so that ultimately people can improve their practice on the ground and make more of a difference and help more people achieve their goals and positive outcomes. What we're seeing as a result of the work we're doing on the new investments in particular, but on the other pathways, I'm sure that will come through too, is organisations coming together to recognising that 3 or 4 FTE in a small NGO are not going to have the resources they need to be able to put those systems in place. And unsurprisingly, 2 of our 10 investments, therefore, are in collectives where people have come together and are looking at shared data infrastructure that supports multiple organisations. I think that's not to say that small NGOs delivering a small community service need lots of tech and data and systems. They don't. But if you are working in spaces where you do have to record risk, where you do have to understand progress, and you do have to build that learning back into your practice, it's very difficult to do that with bits of paper and what's in people's heads.
One final question. On the duration of contract that I think that Honourable Gentinetti has also addressed as a concern. Let's say early years support, you're funding 50 per year. Are those, and you mentioned before that you won't see outcomes for 5 to 6 years. Are those 50 per year being funded for 5 years at a minimum? Are the contract for 5 years?
So the contracts are for 4 years.
But 4 years is 50 per year. I'm asking whether those 50 per year will be continued, be supported for 5 years.
Yes. So and it actually gives me a chance to make a point more cleanly than earlier. Because when you talk about people and their varying levels of need and challenges, organisations ultimately make a call on what's the proportionate response. They might find that they can give a family, in that case, the skills, capabilities that they need to support their young person into school age in a short amount of time. They might stay alongside that family for a long time. And that ability to be able to flex to the individual needs of children and families is critical. Because a lot of our service specifications set times. You do all this within 12 weeks, you do this within 6 months. And that could be too much for some people and too intrusive, and could be too little for others. So that ability to flex is absolutely critical.
Well, just as a supplementary point around integration, because one of the concerns that's been expressed to me multiple times is multiple truck rolls going up people's driveways. All the different agencies have got a specific, responsibilities and specific appropriations. But that is exhausting for vulnerable families. So what is there an opportunity in the work you're doing to reduce those truck rolls?
Ultimately, I think, again, it's a little bit of flipping on its head. At the moment, it's every government agency going in and working with that whānau. We need to flip it on its head of what does the whānau need, and then work backwards from that particular sense of who is the most appropriate provider to be working with them and who is supposed to be funding that. We need to be, there is a line there though. If there's, like I alluded to before, if there's statutory responsibilities, some agencies just do need to be there. But there's ability to simplify that and again, put it into the whānau's perspective of what is the support that they particularly need. And depending on the individual circumstances, there is a place for us to do that. However, social investment, a lot of social investment is about prevention. So those 5 cars up the driveway type thing happen usually at a crisis, and we should be there before that. Hopefully stopping those cars turning up to the driveway.
Last question, Jen.
Well, it kind of follows on from that because this approach has been used successfully in the past, and from my perspective, one of the most successful was Kotahi Te Whakaaro, which some of you know really well. And it was, again, consolidation of the different agencies, having those discussions, who was the most appropriate going in. So it was a real place-based solution. Can you give assurances that the 7 initiatives that have been announced are place-based to stop that sort of thing happening, as opposed to being program-based as they've been reported in the media being program? That gave me a little bit of, oh my goodness, are we going back in time here?
Yep, I think Joe's best placed to answer that.
Yeah, absolutely. That initial test of whether that investment is credible and worth making, we look very strongly at local relationships. And we actually published a shortlist of the initiatives that we're considering funding online and asked for feedback, and we will continue to do that because of that commitment to transparency. So by way of example, we wanted to know that if one organisation was going to set up in Hamilton delivering a service that was particularly around young people that were getting involved with the police, that the police were absolutely on board. And we actually facilitated conversations and tested that to make sure that those connections were in place. And that service opened last week. We will also particularly look to organisations that are deeply embedded and have that connection between the operational and strategic end, which everyone remember well, that ability to understand, sit at a table every day looking at family harm incidents or children that had reports of concern, understanding that at that very granular level, and then being able to shape social services around that intel. So Aotearoa Social Health Services in Whakatane, who we've invested in, are very much in that space and are bringing those two operational and commissioning of services together.
Which is great to hear. I just think we need to get the language right around that, because it is quite wrong at the moment how it's being reported.
Thank you.
Yeah.
Well, thank you very much for appearing for the committee today. You obviously are keen interest in what you're doing. We wish you all the success going forwards. Important piece of work. Thank you.
Thank you very much.